And so, obviously culminating with health care. And everything changed after the Scott Brown election in Massachusetts, huge upset, and that only changed from the perspective of they decided to go the reconciliation route. As you all know now, the health care bill becomes law. The Senate health care bill becomes law. Reconciliation bill becomes law with the added student loan provision that we didn't have any hearings on, which is basically the federal takeover of the student loan industry. And now we go back to Washington next week for more. As many of you know, or all of you know, there are a number of attorney generals, mostly Republican, one Democrat from Louisiana, who are challenging the health care law. It'll take time through the court system, but in talking to a number of constitutional lawyers, and including a breakfast that I had with Justice Scalia about a month ago with a number of members of Congress, he doesn't believe that any judge worth his or her salt will see that this is constitutional. What I mean with this, that the individual mandate in this bill will be constitutional. Here's why. Never before in the history of the United States has the Congress ever required you to buy something, a private product. This is a first. We are requiring you to buy insurance. And if you don't, we're coming after you. The IRS, which will hire, they say they need 16,500 more IRS agents to implement this enforcement provision. So now we know where the jobs are being created. 16,500 more IRS agents to implement this mandate on you. We believe that that is fundamentally unconstitutional, and ultimately the court, the Supreme Court probably will find it unconstitutional. They tried the best they could through the tax code, because they're making this a taxable event, but still the requirement is to buy insurance, and we believe that's unconstitutional. There's a couple other challenges, but we believe that is probably, many believe that is probably the one that is the strongest based upon the constitutionality. Now, we believe that Republicans believe that we should do everything we can to repeal this and replace this health care bill with a better bill, with a better law. One that we talked about, by the way, over the course of the last year, some of which we tried to implement, that we were unsuccessful to get past the Senate when we were there. And you've heard much of that already. One of the things that we were able to do when we were in charge is provide health savings accounts for people, which we believe is a way to get people more engaged in their health care. Third-party insurance actually shields us from the true cost of health care, which makes health care go up. Liability reform would help keep costs from going up, because doctors have to test people unnecessarily just to cover their backside or the hospital's backside. Of course, there's nothing in this bill that provides fundamental reform of our liability system or lawsuit abuse. We also believe there needs to be competition in the insurance industry. When you go home tonight and you want to get new health care insurance or auto insurance, you can go online and you can get 100 different companies' quotes on auto insurance or property and casualty insurance. Healthcare, just not there, not happening. This bill does nothing to do that, by the way. And so we believe giving consumers the ability to purchase insurance, health insurance across state lines will provide that competition, allowing associations to band together to form a bigger buying power would be a good thing. Anyhow, the reality is, if the Republicans, and not everybody believes that Republicans will take control of the House and the Senate next year, or this year, for next year, in the likelihood that we do, there's nobody who believes that we will have a majority big enough in the House or in the Senate to overcome a presidential veto. And the reality is Barack Obama is going to be there for another 3 years, at least. And so the best that we could do is slow this down, stop the implementation of this bill as best we can through the appropriations process by controlling the spending. And most of you already know the biggest fallacy of this bill is that it begins immediately. There are things that do begin immediately. The most popular provisions that have bipartisan support, like dealing with pre-existing conditions. But the fact of the matter is, the bulk of the benefits don't begin until 2013. Some of the more controversial taxes don't begin until 2013. And the doctor fix is not even in this comprehensive health care reform bill. That will come later. So the reality is, until you have a president who wants to repeal some of these things that are going to happen in 2013 or 2014 or 2015 or 2016 or 2017, some things happen in 2018, the reality is, until you have a president who's going to be willing to work with the Congress to repeal some of these things, the best you can do is hope to slow it down and put pressure on the current administration to come to the table and negotiate. But this is tough. Once this passes, this is really hard. And the shame of it is, quite frankly, in terms of the entitlement spending, the huge deficits that this is going to create, the shame of it is this is not going to reform our healthcare system. What it is a coverage bill. We're covering 32 million more people. 16 million, by the way, who are going to end up just going on Medicaid. The Government Accountability Office has already told us that Medicaid and Medicare are broken, going bankrupt. You add 16 million more people to a broken system. And by the way, if you're a doctor, Medicaid reimburses about 65 cents for every dollar that you are providing. Same with the hospital. Medicare about 85 cents. We already have doctors beginning, and some of you may know this, beginning to say, I'm not going to take any more Medicare patients. I'm not going to take any more Medicaid patients. This is going to actually speed up that process. I've talked to physicians, and you can hardly blame them. So then what happens is the doctor in the hospital cost shift because they're not getting reimbursed properly for Medicaid or Medicare. They cost shift to the private plans. What the private plans do is just pass that on to the employers and to the individuals who buy insurance, and their insurance goes up double digits. So my prediction is, you may have heard it already, but if you haven't, you heard it here first, insurance is going to continue to go up. Health insurance is going to continue to go up later this year. Employers are going to continue to pay more. Individuals are going to continue to pay more. And then Nancy Pelosi will say, well, you know what? That's why we need a public option. I guarantee that's what will come out. And that'll be the next step. This is a step. This is a step. And some Democrats actually were brave enough to say it, including Barney Frank. This is a step toward universal health care. Government-run universal health care. And there are a number of elements in this bill that lay the groundwork for that. So we have to turn that around.